In this video, you will be discovering the very best Medicare supplement plans for retirees. Before we dive in, if advertisements should interrupt this video, please do not click off of the advertisements. Please allow them to play through as a thank you to me for bringing you this honest, valuable information for free. Now let's continue. Hello, my friend. Let's talk about a financial ticking time bomb that many retirees don't even know they have. The moment you leave your employer-sponsored healthcare and step into the world of Medicare, a critical clock starts ticking. The choices you make in the next 6 months are not just about picking a plan. They are about protecting your entire life savings from a single, unexpected medical emergency. We're not talking about a small, easily manageable bill. We're talking about catastrophic out-of-pocket costs that could completely derail your retirement. But here's the good news. This isn't an episode of fear-mongering. It's a lifeline. My purpose today is to equip you, to educate you, and to empower you to make the single most critical healthcare decision of your life. This video is going to cut through all the jargon and confusion and give you a simple, clear, and actionable guide to finding the best Medicare supplement plans for retirees. I promise you, if you stay with me until the very end, you will walk away with a crystal clear understanding of your options and the confidence to choose the right path to protect your health and your wealth. To understand what we're about to discuss, you must first understand the foundation, original Medicare. Think of it as the basic, federal government-run health insurance program. It's a two-part system. We have Medicare Part A, which primarily covers your inpatient care, things like hospital stays, skilled nursing facility care, and hospice. Then we have Medicare Part B, which is for your outpatient care, your doctor visits, lab tests, and medical equipment. But here's the crucial point, the one that makes this conversation so vital. Original Medicare, for all its value, has some pretty significant gaps in coverage. It doesn't pay for 100% of your costs. You are still responsible for paying deductibles, co-payments, and coinsurance. Let's look at those gaps. With Part B, after you meet a relatively small annual deductible, for 2026, it is projected to be around $257. You are still on the hook for 20% of all costs, and here's the part that keeps me up at night. There is no annual limit. That's right, no out-of-pocket maximum. So if you have a serious illness or injury, that 20% can add up faster than you can imagine. For a major procedure or a serious health event, a 20% share of the cost could be thousands, even tens of thousands of dollars, an amount that could decimate a retirement fund overnight. This is precisely where Medicare Supplement Plans, also known as Medigap plans, become your financial fortress. The name Medigap is perfectly descriptive. They are designed to fill in the gaps left by original Medicare. They are sold by private insurance companies, but here is the key, the golden rule of Medigap. They are standardized by the government. What this means for you is that a Plan G from Company A offers the exact same benefits as a Plan G from Company B. The only difference is the price and the company's reputation. This standardization is a gift. It means you don't have to waste time comparing different benefits packages. You just have to find the right Medigap plan for your retirement needs, and then find the most reputable, well-priced company that offers that plan. So, let's explore the plans that are most relevant to you today, especially if you are a new retiree. When it comes to the best Medicare Supplement Plan G for retirees, the consensus is clear. Plan G is widely considered the gold standard for new enrollees. It's the most comprehensive plan available to those who became eligible for Medicare after January 1, 2020. Plan G covers nearly every single one of the gaps that original Medicare leaves behind. This includes your Part A and Part B coinsurance, your Part A deductible, and all the Part B excess charges. Let's quickly define Medicare Part B excess charges. What are they? Some doctors and providers who accept Medicare can still charge up to 15% more than the Medicare-approved amount. This is what's known as an excess charge. For example, if a service is approved for $1,000 and a doctor charges 15% more, that's an extra $150 that you would normally have to pay. But with Plan G, you are 100% protected. This peace of mind and predictability is a huge selling point. Once you've paid your small annual Medicare Part B deductible, which for 2026 is projected to be around $257, that is the only thing Plan G doesn't cover. After that, you can go to the doctor or hospital as often as you need, and your bills for Medicare-approved services are essentially zero. No copays, no coinsurance. Nothing. It is the ultimate set-it-and-forget-it plan for those who want absolute financial predictability. Now, let's talk about the second major player, Plan N. Is Medicare Plan N worth it for seniors? This is a question I get all the time, and the answer is, it depends entirely on your financial tolerance and your habits. Plan N offers a lower monthly premium than Plan G, and for that lower price, you accept a few small out-of-pocket costs. With Plan N, you will have a copay of up to $20 for some office visits and up to a $50 copay for emergency room visits if you are not admitted. This is the primary trade-off. The other key difference is that Plan N does not cover those Part B excess charges. So, if you live in a state where these charges are prohibited, Plan N can be a superb, cost-effective choice. If not, you need to be very sure that the doctors you see accept Medicare assignment. The fundamental choice between Plan G and Plan N is this. Do you want to pay a higher premium for total peace of mind and zero out-of-pocket costs at the point of care? Or do you want to pay a lower premium and be willing to handle a few small copays and potentially some excess charges? The choice comes down to your budget and your personal preference for predictability. What about the high-deductible Medicare Supplement Plan G? This is a fantastic option for a specific kind of retiree, the one who is generally healthy and wants to protect themselves from a major, catastrophic medical event. This plan has the lowest monthly premium of all the Plan G options, but it has a significant annual deductible. For 2025, that deductible is $2,870, and it is likely to be similar for 2026. This means you are responsible for all of your Medicare-approved costs, including the Part B deductible, until you reach that deductible amount. After that, the plan pays 100% of all remaining costs, just like the regular Plan G. This plan is perfect for a very healthy retiree who wants to protect themselves from a major, catastrophic medical event, but doesn't want to pay a high monthly premium. Think of it as a financial safety net. It's the ultimate protection against an unexpected hospital stay or a serious diagnosis. Your out-of-pocket spending is capped for the year, and your monthly premium is incredibly low. For many, this is the perfect balance between risk and reward. And finally, Let's address a point of major confusion: Plan F. I know many of you are asking, what about Plan F? And is it still the best? Here's the most important thing you need to know. Plan F is no longer available to new Medicare beneficiaries who became eligible for Medicare on or after January 1st, 2020. If you were already on Medicare before that date, you can keep your Plan F or even switch to another Plan F. But if you're new to Medicare, you must look at Plan G or Plan N as your primary options. Plan G is essentially the new Plan F, with one small difference: it doesn't cover the Part B deductible. So, now that you know the major players, you're probably asking, okay, but how to choose a Medigap plan that's right for me? Let me give you a simple, 5-step blueprint. This process has helped thousands of people just like you make the right choice, and it will give you the clarity you need to move forward. Step 1. Be honest about your health and financial situation. This is where it all begins. Be brutally honest with yourself. Are you generally healthy and rarely see a doctor? Or do you have multiple chronic conditions and anticipate frequent doctor visits, tests, and procedures? Also, what is your budget for a monthly premium? A higher premium will give you more comprehensive coverage and lower your risk for out-of-pocket costs. A lower premium means you take on a bit more of that risk yourself. There is no right or wrong answer here. There is only the right answer for you. Step 2. Understand the plans available. As we've just discussed, this means understanding the differences between Plan G, Plan N, and the high-deductible Plan G. Remember that the benefits are standardized. You don't need to worry about what a company calls its plan. You just need to know what the letter stands for. For a healthy person on a budget, Plan N could be a fantastic fit. For someone who wants total peace of mind and doesn't want to worry about a single bill, Plan G is the way to go. And for those who are healthy and want to protect against a major event while keeping premiums low, the high-deductible Plan G is a perfect solution. Step 3. Compare premiums from different insurance companies. This is a step many people skip, and it's where you can save a significant amount of money. Since the benefits of a Plan G are identical across every insurance company, the only thing you are shopping for is price. Do not assume that the first quote you get is the best one. Prices can vary dramatically based on the company's pricing strategy, your age, your location, and even whether you have a spouse on the same plan. This is a perfect example of a little bit of effort saving you hundreds or even thousands of dollars over the course of a year. Make sure you get quotes from at least 3 different, reputable companies. Step 4. Consider the company's reputation and customer service. While the benefits are standardized, the service is not. Research the insurance companies you are considering. Look for reviews and check their financial strength ratings. A company's reputation for paying claims promptly and providing excellent customer service is invaluable. A smooth and easy claims process can be a huge relief if you ever need it. I often say, choose a company that won't just take your money, but will be there for you when you need them most. Step 5. Act during your open enrollment period. This is the single most critical piece of advice I can give you, and it directly relates to the urgency I mentioned at the start of this video. Your Medicare Medigap open enrollment period is a one-time, 6-month window that begins the month you turn 65 and are enrolled in Medicare Part B. During this period, insurance companies cannot deny you a Medigap policy or charge you more based on any pre-existing health conditions. It's called a guaranteed issue right. If you miss this one-time window, you may be subject to medical underwriting, where an insurance company can look at your health history and potentially deny you coverage or charge you a significantly higher premium. This is why the urgency is so real. Do not miss this window. I also want to briefly address a point of major confusion for many retirees. The difference between Medicare Supplement versus Medicare Advantage. This is a choice you have to make, because you cannot have both at the same time. A Medicare Supplement plan works alongside your original Medicare. You see any doctor or hospital in the country that accepts Medicare, and your Medigap plan fills in the gaps. You do not have a network, and you do not need referrals. A Medicare Advantage plan is a private, all-in-one plan that replaces your original Medicare. It often includes Part D prescription drug coverage and may offer additional benefits like dental, vision, and gym memberships. However, most of these plans use a network of doctors and hospitals, and you may need a referral to see a specialist. Your out-of-pocket costs are generally lower with Medicare Advantage plans, but you have copays and coinsurance for almost every service. So, the fundamental choice is this. Do you want a plan with a higher monthly premium and very few out-of-pocket costs at the point of care, along with the freedom to see any doctor in the country who accepts Medicare? That's a Medicare Supplement Plan. Or, do you want a plan with a lower monthly premium, more benefits, but with a network and copays? That's a Medicare Advantage plan. The right choice is personal, and it comes down to what you value most. But for retirees who prioritize predictability, financial protection from catastrophic events, and the freedom to see any doctor, a Medigap plan is often the preferred route. The key takeaway from today is that you are not powerless in this process. You have choices, and by taking these steps, you can secure your health and your financial future. Whether you choose the comprehensive coverage of Plan G, the cost-effective trade-offs of Plan N, or the high-deductible safety net, you are making a conscious decision to protect yourself. This is not a decision to be rushed, but it is a decision that demands your attention now. The information we've covered today, from understanding the standardized benefits to recognizing the importance of your open enrollment period, is designed to be your guide. I urge you to take this information, research the plans and companies in your specific state, and consult with a licensed professional who can provide tailored advice. Your well-being is worth it. Now, before you go, I want to make sure you don't miss out on more vital information. If you found this video helpful, please subscribe to our channel. Subscribing is completely free, and it ensures you won't miss our next value-packed video on healthcare and insurance planning. Health and wellness is a lifelong journey, and we are committed to being your trusted guide. Also, if you gained any value from this free information, please do us a favor and click that thumbs up button. It helps us reach more people who need this vital advice. And finally, leave a comment below and say, "This was helpful, and I love this video." Your feedback is so important and helps us create content that truly serves you. And remember, my friends, the information in this video is for equipping, educating, and empowering, and is not professional advice. Thank you for your time. Be well.